start recording that. And anything you want to say before we start, Beth?
No, I'm just really pleased to have Eileen back. She's done a couple of workshops for us, so I'm really looking forward to hearing a little bit more about arrhythmia. I don't know a lot, so this ought
And
to be great.
and the interesting thing is Eileen is now our workshop coordinator to get presenters.
She is.
Yes, so we
Yes,
are excited about that part of it. So if you
we
have any
are. Yep.
questions while Eileen is giving her presentation, just jot them in the comment section and we will pass that on to her, especially when all three of us come back together in about 20 minutes. So Eileen,
Yeah.
we're just going to let you take off. Go for it.
All righty. Okay, thank you, Paul and Bev. So again, this month's workshop is on arrhythmias. I had a whole bunch of great slides prepared and I'm looking at them right now. They're awfully pretty. I wish I could describe them to you, but due to some technicalities, I don't get to share them. So hopefully you won't all get bored just listening to me. But so anyways, arrhythmias. Now, I personally have had an issue with PSVT since I was a lot younger, but it became really bad after a spinal surgery that I had in 2013. While I was recovering, just simply elevating my head would trigger the arrhythmia. And so to this day, I still have to take electrolyte supplements, beta blockers, control my stress, watch my diet, avoid stimulants, exercise regularly, and monitor my blood pressure and heart rate just to stay ahead of the game. So tonight, what we're going to do is just quickly cover the basic anatomy and conduction of the heart, types of arrhythmias, causes, risk factors, screening and prevention, signs and symptoms, complications, diagnosis, treatment, living with, and where you can find more information. So starting off with the basic anatomy, if I had a nice little heart here to show you, we'll just imagine the nice, beautiful little heart. Okay, so as you already know, the heart is a big muscle that pumps blood around the body. And the unoxygenated blood from the body flows into the right atrium at the top and, from the superior and inferior vena cavas. And at the same time, the oxygenated blood from the lung flows to the left atrium from the pulmonary veins. Then, once both of these atrium are full, they then contract, squeezing the blood down into those lower ventricles, the two ventricles. Once the ventricles are full, they then squeeze or contract, squeezing that blood up and out, either off to the lungs where the blood can be oxygenated or off to the body to deliver that oxygenated blood. So, but then there's also the cardiac conduction system. This is the very specialized conduction system that keeps all these muscle cells contracting in this perfectly coordinated, well, it should be more like this, coordinated rhythm for your entire life. Now this signal begins up in what we call the SA node or the sinoatrial node. That's up in the, let's see, that would be the right atrium. And the signal starts there and then it rapidly spreads across both atrium, telling them to contract in unison. So when this happens, the signal also travels down just a little bit, reaching what's called the AV node or the atrioventricular node. It then fires, sending a signal further down to what's called the AV bundle branches and off to the Purkinje fibers, which are the nerves that kind of surround the ventricles to coordinate those to fire, okay? So basically, an arrhythmia is a problem with this rate of the heartbeat or the speed, okay? And during an arrhythmia, the heart can either beat too fast, too slowly, or with an irregular rhythm. And arrhythmias can differ from normal heartbeats, like I was saying, in this speed or the rhythm in which they're doing this. And arrhythmias are also grouped by where they occur. So if they occur in those upper chambers, they can either occur in those upper chambers of the heart, the lower chambers of the heart, or in that area in between the chambers where those signals are traveling. Now, the main types of arrhythmias are bradyarrhythmia, tachycardia, and premature or extra beats. The bradyarrhythmia is a slow heart rate. It's also called bradycardia. And for adults, bradycardia is defined as a heart rate that's slower than 60 beats per minute. Although some people, especially if they're young or physically fit, may normally have this slow heart rate. Now, tachycardia occurs when the heart rate at rest goes above 100 beats per minute. And this fast pace is sometimes paired with an uneven rhythm, and sometimes the upper and lower chambers will beat at different rates. Now, a premature or an extra heartbeat happens when the signal when the signal to beat comes too early. It can actually feel like your heart skipped a beat. So what it does is it creates a short pause followed by a stronger beat, like it's catching up as it returns to its regular rhythm. And these are the most common types of arrhythmia. They're called ectopic heartbeats, and they can actually trigger other arrhythmias. So back to the anatomy of the heart, the arrhythmias that start in those upper chambers are called supraventricular arrhythmias. And they're known for that fast heart rate, or the tachycardia. So types of these supraventricular arrhythmias include atrial fibrillation. So think of it as, just going so fast, it's just fluttering in the wind, okay? Well, it's not a flutter, that's the fibrillation. And this is the most common type of arrhythmia. And the heart can race at more than 400 beats per minute. And then atrial flutter is when those upper chambers beat at more like a 250 to 350 times per minute, which is still crazy fast. Now, a PSVT, or paroxysmal supraventricular tachycardia, got that one out. That's when extra signals that begin in those upper chambers travel to the lower chambers and cause extra heartbeats there. Now, this arrhythmia usually begins and ends suddenly and happens a lot during vigorous activity, but is not dangerous and usually just ends quickly. Now, a ventricular arrhythmia, that's those lower chambers again. These can be very dangerous and require medical attention right away. Ventricular tachycardia is a fast, regular beating of the ventricles that may last for only a few seconds. A few beats doesn't cause problems, but if the episode lasts for more than a few seconds, it can be dangerous and trigger a more serious arrhythmia like ventricular fibrillation. Now that's where it's just, you got all these mixed up signals making the ventricles just quiver instead of pumping normally. And when they're not pumping, then there's no blood going out to the body. And that's when you get sudden cardiac arrest and death can occur in just a few minutes. So, what causes an arrhythmia? Well, typically arrhythmias are set off by a trigger, and typically an arrhythmia is set off by a trigger, and the irregular heartbeat can continue if there's a problem in that heart. So changes to the heart, these triggers can be like changes to the heart, so like reduced blood flow or damage to the electrical system of the heart, or when you're restoring blood flow back to the heart as treatment after a heart attack. Or there can be changes in it, due to stiffening of the heart tissue, known as fibrosis or even scarring. And then strong physical or emotional stress and anxiety, or anger and pain, or sudden surprise can also make the heart work harder, raising your blood pressure and releasing stress hormones. And sometimes this extra stimulation can, lead to an arrhythmia. Now, if you have heart disease, physical activity can trigger an arrhythmia due to an excess of the hormones, such as like adrenaline. And sometimes just even vomiting or coughing can trigger an arrhythmia. Also, imbalances in the blood. So like an excess or deficiency of electrolytes or hormones. So say like thyroid hormone, an excess of thyroid hormone can cause the heart to beat faster, or a deficiency can slow your heart rate. Dehydration will cause your heart to race, Low blood sugar, or from an eating disorder or too much insulin, can lead to slow or extra heartbeats. And like I was saying, electrolytes, so low levels of potassium or magnesium or even calcium can trigger an arrhythmia, and especially after surgery or a heart attack. And then there's even certain medications that can cause arrhythmias, blood pressure medications, even ones that they're using to treat an arrhythmia can cause an arrhythmia. Side effects from depression and psychosis medications can also trigger them. And even antibiotics and over-the-counter meds can do this too. So you got to be really, really careful. And then, of course, if you already have problems with the electrical signals in your heart, an arrhythmia can just occur if there's somehow just anyway delayed or blocked. And these are called conduction disorders, if you already have those electrical issues. So now, risk factors for an arrhythmia. Well, the main risk factors being race or ethnicity, sex, surgery, age, environment, family history and genetics, and your lifestyle and habits. So like with race and ethnicity, studies suggest that white Americans are more likely to have arrhythmias, such as atrial fibrillation, while African Americans have higher rates of high blood pressure and other arrhythmia risk factors. As far as gender, studies suggest that men are more likely to have atrial fib than women. And however, at certain times of the menstrual cycle or pregnancy can increase a woman's risk of arrhythmias. And then surgery, you might be at a higher risk of developing atrial flutter in the early days or weeks after surgery involving your heart or lungs or esophagus. And then the chances of having arrhythmias grow as we age because of changes in that heart tissue and how it works over time. Plus, older people are just more likely to have, more health conditions that raise the risk of an arrhythmia. And some types of arrhythmia happen more often in children and young adults, like ones due to congenital heart defects or inherited conduction disorders. Your environment. So some research suggests that exposure to air pollutants is linked to short-term risk of an arrhythmia. You may have an increased risk of some types of arrhythmia if your parents or other close relatives have had them too. And like I was saying with lifestyle habits, drinking alcohol, smoking, using illegal drugs such as cocaine or amphetamines, those stimulants can trigger that arrhythmia too. Other risk factors are, just like I was saying, having a history of medical conditions like aneurysms, autoimmune disorders, cardiomyopathy, which is, affects your heart muscles. Like I was saying, diabetes or low blood sugar, eating disorders, having a heart attack, heart inflammation, heart failure, high blood pressure, viral infections such as influenza or COVID-19 or having sepsis, kidney disease, lung disease such as COPD and sleep apnea because they stress the heart by preventing it from getting enough oxygen, and musculoskeletal disorders, obesity, and like I was saying before, thyroid issues like Graves' disease. So there's so many different risk factors. Now, as far as screening and prevention, okay, well, screening tests. Now, if you or your child is at an increased risk of an arrhythmia, the doctor may want to do a screening to assess the risk of a life-threatening event. And, because sometimes, for children to participate in competitive sports now, they have to do these screenings to make sure that they don't have any congenital defects. So some other screening tests your doctor may recommend based on your risk factors are an EKG or ECG, and that's the electrocardiogram. This is the main test for detecting arrhythmias. It records the heart's electrical activity. Your doctor might do this test while at rest or when the heart's under stress. And if they're able to detect, if they're unable to detect it in the clinic, then your doctor might give you a portable monitor to wear home so that they can try to determine what situations are causing it. And then genetic testing can help you understand your risk, especially, again, genetic testing is going to be really important if your newborn or another close relative died suddenly. Having troubles getting this one out, because of the risk of SIDS. Okay, that really puts the infants at a higher risk of SIDS. And or they might want to do imaging tests like an MRI to look for scarring or other issues going on with your heart. As far as prevention, the best prevention strategies are going to be to avoid these triggers, learn your triggers, and avoid those triggers like caffeine and stimulants. And I hate to say this, but even cannabis can trigger an arrhythmia. Avoiding those triggers. You might need to wear an implantable or wearable cardio defibrillator. You might consider making heart healthy lifestyle changes, such as healthy eating, being physically active, aiming for a healthy weight, quitting smoking, and managing stress. And your doctors will want to definitely monitor you after any surgeries, especially if you're having heart surgery, for any of these electrolyte imbalances too. Now, as far as the symptoms, the signs and the symptoms, an arrhythmia may not cause obvious signs and symptoms. You may just notice that something only occurs occasionally, or your symptoms might become more frequent over time. So these signs and symptoms might include a slow or irregular heartbeat. You might feel those pauses between the heartbeats, feel those palpitations, or feeling like your heart skipped a beat. It may feel like it's pounding or racing, or even have chest pain. And then more serious signs and symptoms include, of course, that chest pain. That's a very serious sign. But anxiety, blurred vision, difficulty breathing, fainting or nearly fainting, foggy thinking, fatigue, sweating, weakness, dizziness, lightheadedness. Those are all signs that the blood is not pumping around. So, as far as the complications, well, if these arrhythmias are unrecognized and left untreated, they can sometimes cause life-threatening complications affecting the heart and the brain. So with your heart, you could end up developing heart failure. You could have sudden cardiac arrest, worsening arrhythmias, or like I had said earlier, it could cause SIDS, sudden infant death syndrome. It could even trigger a stroke. Now, with a stroke, what's happening is the blood can pool in those atria, forming little clots. And then as those beats start kicking back up, it knocks those clots loose, and those go out into the bloodstream, and then you have a stroke, or you could have a stroke. And with the brain, you can develop cognitive impairment, dementia, Alzheimer's disease, and like I was saying, strokes. And these can all be due to reduced blood flow to the brain over time. Now, as far as a diagnosis, how would your doctor diagnose this arrhythmia? Well, first they're going to, talk to you about the symptoms you've been feeling, what triggered them, what exactly you're feeling and everything. He's going to take your medical history and look at any signs of arrhythmias in your family. May also do that EKG I was talking about, and what other tests they may need to do, like the stress test and all. But during that physical exam, things they're going to look for is going to be like swelling in your legs and feet. He's going to check your pulse to see how fast your heart is beating. He's going to listen to your heart, to listen to that to the rhythm of that, and even listen for heart murmurs. And they're of course going to check you for other signs of disease, such as thyroid disease and things that could be causing these arrhythmias. Or they could go all out crazy and order crazy tests, more blood tests looking at, again, those electrolyte levels. They might even have a cardiac catheterization done to look at, to see if there's been any damage done to the heart, or a chest x-ray to see if your heart's been enlarged. The echocardiography to see the size and the shape of your heart and how well it's working. The Holter or the event monitor, again, those are the ones that record the activity over long periods of time as you do normal activity. And then there's even implantable recorders that stay in there for a long period of time to record just as these events are happening. So you don't have to press like a start button. Or they'll even just do ultrasounds. Like if it runs in your family, they'll do ultrasounds to check out the baby to make sure there's nothing going on with baby. So if you have an arrhythmia, how does the doctor treat it then? Well, the most common ways of treating it, of course, are with medications. Medications include things like adenosine, and that one slows down a racing heart, or atropine. These are the ones that the paramedics will use. That one's used to speed up the slow heart. Beta blockers, like I take, those are used to treat high blood pressure or a fast heart rate. Or they'll give you blood thinners for the blood clots that are flying around. They also use potassium channel blockers or sodium channel blockers. I mean, there's so many different medications depending upon where exactly that arrhythmia is starting, which chamber, or if it's more to do with that electrical system. But if the medications aren't working, then the doctor may have to, try some medical procedures. And as far as the medical procedures, the most common one they'll do is called cardioversion. And that, if you want to think of a much milder version of, the paramedics shocking you, it's not like that, but they will sedate you and mildly shock your heart back into a correct rhythm. Or if there's been damaged tissue to the heart, that's, if you remember, I told you about the pacemaker cell, that SA node, and then the AV node telling the heart, stroke, 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 stroke. Well, every now and then when there's damaged tissue, you can get a little smart aleck over here going, stroke, 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 sending crazy signals all over the place. So with those, what the doctor goes in and he does what's called a catheter ablation. They go in and use heat or cold to pretty much fry out those bad cells so they can't send that mixed up signal anymore. And then if, we'll say those work, but you keep having problems, well, then the doctor may want to consider putting in permanent devices like a pacemaker. And the pacemaker, if you remember, again, that pacemaker cell setting that rate at the top, that's what the pacemaker is doing. It's implanted up there to set that rate. Or they may put in a what's called an ICD, implantable cardioverter defibrillator. That word's hard to get out too. And so what that one's doing is waiting for those other ones to go into that crazy spasm, and then it does that shock to get it going back in sync again. And those are happening without you even noticing. You might be having a conversation with someone and they just go, "Ooh, well, that was weird. My defibrillator just went off." Like, thank God, because I don't remember CPR. Oh, bad joke, I'm sorry. So other treatments for arrhythmias may include, things like, managing the underlying conditions, using supplements to treat the magnesium or other electrolyte deficiencies. And there's certain techniques you can use to slow your heart rate and stimulate your body's natural relaxation process. And this is by affecting the vagus nerve, which helps control the heart rate. And these techniques include having you cough or gag, or have you hold your breath and bear down, which is called the Valsalva maneuver, They may have you lie down or put a towel dipped in ice cold water on your face. It's not just in movies, it really does work. And even things like BioTouch healing has been shown to reduce blood pressure and slow your heart rate. And healthy lifestyle changes, like I was saying before, can help lower your risk for conditions such as high blood pressure and heart disease. Like, again, aiming for that healthy weight, being physically active, heart healthy eating, quitting smoking, and managing stress. Because again, we're trying to calm down that autonomic nervous system and that vagus nerve, right? So again, that's where something like BioTouch is going to come in really handy to help you manage those stress levels. And so, well, I got through this pretty quickly. So really, in summary, if you've been diagnosed and treated with an arrhythmia, make sure to follow your treatment plan set by your doctor, because this is literally life or death, okay? And your ongoing care will reduce the chance that you will have another episode or a complication. And keep your regular appointments and ask about healthy lifestyle changes that you can make to keep your arrhythmia from happening again or from getting worse. Then I wanted to give you guys more information where you could go. I can't show you these links, so I'll just tell you really quick. The National Institute of Health, the NIH, has a really good website. They have a section on arrhythmias and also guides to living well with heart disease, and also really good information on Graves' disease and SIDS.
Okay.
And
Wow.
back to you, Ms. Bev.
Wow.
Oh my goodness. Well, I want to just say one thing. It's not just arrhythmia, it's arrhythmias.
Yeah.
Because I had no idea.
No, neither did I. I thought arrhythmia was one thing and that was it.
And then Eileen, that was awesome. I mean, I have so much more, maybe more information than I need, but that was really great because I have a completely different understanding about the heart and how it works and well, just that there's more than one arrhythmia.
Right.
In all these different chambers and ventricles, and wow,
I like the idea of the I always like when they talk about the heart as an electrical unit.
Yes.
That's that just goes right along with us trying to add BioTouch to the program.
Oh,
But
man.
again, I like how you presented the whole idea of a heart. Here's standard protocol, and here's things people can do, and
Right.
it just gave us a jump into us teaching the sets to work with that. If anybody has any questions for Eileen, I posted her website, BioTouch Dove Mountain, and she'd be happy to get back with you. She'll do consulting work with you and the work that she does. She can also teach you BioTouch because she's one hell of a good instructor too.
Yes.
All right. So Eileen, we appreciate it. I don't see any questions. We had quite a few people here listening to you. We're going to post this for others, and we'll see you soon. We're going to take off and teach the points. So
good
thanks,
night,
Eileen.
everyone.
Thank you, Eileen. Thank you, dear. Appreciate it.
Okay, so
well,
I'm
we
exhausted.
don't know what questions to ask.
I know.
I wouldn't know what question to ask.
It's funny because the story of my mother, that was a typical arrhythmia gone awry kind of thing. I mean,
wow.
she passed out in her office. They came, rushed her to the hospital. They put a temporary pacemaker in her heart. And of course, that led to the problem of puncturing the heart, putting her on the operating table. She died on the operating table. They brought her back to life. They said if she lived, she'd be a vegetable. And again, if you haven't heard the story, 6 months later, with a lot of BioTouch, bringing her out of the coma, she was walking on a beach in Hawaii. So we're going to teach you what I did with her. This is great preventative work. This is good long-term care, hell, it seems like we ought to do this all the time. It can come at any time. So
You know what? I was going to say, we're walking time bombs.
we're walking arrhythmias. So,
Yay.
all right, so here's what we're going to do. We're going to teach you the sets of points, the minimum sets of points to do for any kind of heart condition, it sounds like. And so we're going to
Right.
give this over to Bev while I play Mr. Techno here. And
There
here
you
you go.
go.
You're on.
Okay. Before we begin, if you want to get the workbook and look at it with us, and you haven't downloaded it yet, you can go to www.biotouch.com / yeah,
Just
yeah,
like
what he just said, /work book. And then you can find the arrhythmia workbook, which you can have with our blessing, since you are here tonight. So let's begin. And for those of you who have not heard about BioTouch and happen to be here tonight for the first time, we always like to just kind of give you a little introduction to what BioTouch is. And this is on the page 6. We always have on the first page of the workbook just a really nice blog that our foundation scribe always does for us, Paula Taylor. She does a very good job, just gives you an overall look at what the health condition is that we're going to be presenting each time. So you can always begin with that and just get a really good idea of what we're going to be teaching. So what is BioTouch? Well, it is a very simple technique. You're basically using the first 2 fingers of your hands, and you're going to use those first 2 fingers to lightly touch on the skin, holding 6 to 8 seconds. The BioTouch technique is 17 sets of points that absolutely address everything that the body can manifest. So this is a very wonderful technique. And of course, at the end, if you're interested in learning it for yourself, we can do that for you. So let's just quickly go over these 4 main parts, these bullets. So it says on the first one, BioTouch is easy to learn. Even children can learn and practice it. And this is true. We have actually had children in our trainings, and they have a couple of them have gone on to be certified. So I always think of BioTouch. It's so beautiful, and it's so non-invasive, and it's so light and loving that it brings out the children in each of us to trust, to feel safe, to honor, and just to be present with another person. BioTouch is a complement to any healthcare program. For many years, we said BioTouch is just a complement. It's not an alternative. And that's still true, but we have also begun to understand that BioTouch is very integrative. There's this one of the words that is being used in the medical community also, very integrative with everything else. Everything else is integrative with BioTouch, and holistic, because when you touch on the skin, we really don't go to worry about the emotional or the mental state of the recipient. We just want to touch where the stress or the pain is. The body takes care of the rest of it. So what we have seen is all the other parts of ourselves begin to respond, the emotional, the mental, and of course, healing can take place in the body. So it is a holistic system. And it is absolutely integrative and complementary with everything, whether it's a specific diet, any prescriptions you might be on, working with your doctor, other healing techniques that you might want to do, everything goes with BioTouch. BioTouch has no levels of ability. Everyone is effective. And we always say this, the very first time that you learn BioTouch, you can turn to another person and do those different technique with them, and you will be absolutely effective immediately for them. This is why BioTouch, we say it is for everybody, because everybody already has within them the innate love and caring to be able to use BioTouch to help another person. So the moment you learn BioTouch, you're going to be effective for that. There's no special training except for, if you want to go on and actually be certified, we offer the practitioner training that will give you the whole technique. Once you do that, or just like tonight, you're just going to learn a couple of specific sets of points. And if you want to try this BioTouch with someone that you care about in your life that might be, experiencing arrhythmias, then you're going to be effective for them immediately. That much we do know. It's a wonderful, special technique in that. And lastly, BioTouch requires no preparation, no belief system. We have no philosophy. We don't, we're trying to hold a neutral point for everybody. Whatever your belief system is, or whatever you may be doing in your life, your spiritual practice, it doesn't matter. Just being human and wanting to help another person, that is really all that's required for you to practice BioTouch. So that's basically the kind of an overall introduction that we like to give in these workshops. Again, very simple. Before you begin to work with someone with BioTouch, always wash your hands. And then you're going to take the first 2 fingers of each hand, and you're going to touch lightly on the skin, holding each point 6 to 8 seconds. And that's it. That's it. So let's go ahead and use, we do have specific terms that we do use, but these are usually given to, when we do our trainings. It's not really necessary in these workshops, although I do like to introduce you to what the associate, so it's a relationship of healing. So we have the associate, the one who is performing BioTouch, and the recipient, the one who receives the benefits of BioTouch. But I like the description from the dictionary. One often in company with another, implying intimacy or equality, and one having an interest in common with another. So BioTouch is truly a relationship of healing, because both the associate and the recipient, we both receive something, whatever it is that we need. So it's a very lovely technique in that. So let's begin what we call the greeting set. And this you must perform before you do anything else. In fact, if you do nothing but the greeting, you're going to do something for the body. That much we know. It's a beautiful, it's like sets up a harmony between the associate and the recipient in this relationship. So we always want to do that before we do anything else, address anything else in the body. So let us go to the video. Paul's going to play the video on the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same two fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay. So let's move on. I must say that we, with each health condition, we put together the workbook with those 3 or 4 sets of points that will give you the beginning of working with that health condition. So these are always put in the workbooks according to how we feel the importance of these sets are to address any condition. The first one after the greeting, of course, would be the heart, veins, blood pressure, and circulation. And this set really addresses any of those conditions relating to the heart. So this is a very important basic, if you do nothing but the heart set, that's going to be very, very effective and important in addressing arrhythmias. So let's go ahead and watch the video.
This set of points may be used for conditions relating to the heart, veins, blood pressure, and circulation. To perform this set, first find hold point X, which is on the breastbone, directly between where the nipples would be on a youth. Another way to find X is by measuring 1/3 of the way up the breastbone from greeting point 1. To address the well-being of the heart, hold X, and with the other hand touch points 1 and 2. These points may be found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this diagonal line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. Veins, blood pressure, and circulation may be addressed by touching point 3 in addition to points 1 and 2. Point 3 is at the soft indentation just above the collarbone, above and to the left of the notch at the top of the breastbone. It is the same as point 1 in step 1 of the metabolism set. Remember to hold each point for at least 6 to 8 seconds.
Okay. The third set
So
that we
I just wanted to mention while you're on here is, let me show the page again. If you'll notice, one page has the drawing of where the points are, and on the second page we always have a description based on the same words that you just heard on the video. So it's very easy to even just read the manual and know exactly where those points are, because they're all explained in terminology that are mundane words. Big bones, nipple line of a youth.
Yeah, that's a good point, because that way everyone, you don't, we usually say you don't need to know the anatomy. You just need to know the language of BioTouch that will take everybody to that specific point. So that's true. And the manual, I must say, is set up perfectly, and the video along with it is just an amazing way to learn BioTouch. It's a great tool to have. So let's move on to the third set that we suggest. And of course, based on what Eileen was telling us about arrhythmia, a lot of that is, as a result of emotional and mental, physical stress that shows up, and anxiety. So this is going to be a really good set. I just want to make mention that if you're looking at the diagram, you'll notice that there is a resemblance between the heart set and the stress set. It's those same 2 points. So right there, you kind of get a sense that, oh, this is related. Somehow this works. So let's go ahead and watch the video on the stress and anxiety set.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand, touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
Very easy set, but very effective. And that's a good reminder. You can repeat touching any points in the sets as many times as you feel you want to. It's there's no fast rule about, just remember to hold each one 6 to 8 seconds each time. So let's move to the next set called Metabolism. And this is a great set to use because, knowing that the body knows what to do with BioTouch, this is a great set to use because it helps the body to assimilate or to get rid of either what it wants or what it needs to let go of. So this is a great set to use for many, many things, but it just helps the whole body. So
well, it goes specifically too with Eileen talking about the hormonal system is really involved in heart conditions, and this really addresses the hormone system.
That's right. Yes. So especially those first 3 points, as they'll see in the video, addresses the thyroid and the hormonal patterns. Yes, definitely. Okay, so let's watch the video on metabolism.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
And those are the 4 sets that that are going to be very, very helpful and effective for arrhythmias. So Paul, that was lovely. That was lovely. We're so happy you were here tonight. Just to remind you that if you were, for the next 30 days, this workbook will be available to you. You can go to our justtouch.com website and you can download it.
Yeah, I posted it in the comment section.
Thank you.
justtouch.com/workbook. And for 30 days, you'll have the opportunity to download that for free.
Yep.
And if you want to get any of our workbooks, just become a member. Go online, become a member for $18. You get, there's like 52 workbooks now. Besides, you get the whole manual.
Right.
So these workshops are designed to take pieces out of our whole manual for those who just want to work on a specific health condition. And we will have to change ARRHYTHMIA, and we're going to have to add an S on it.
Yes. That's the one thing I underlined that. I'm like, oh, we're going to have to add an S. Now in my self-awareness.
Yeah, and that's funny because on her slides that she was going to show, she did have an S on it.
Yes. She knows what she's doing.
She does. She is awesome. Bev, you are awesome. All of you out there are awesome. If you plug into our Monday show, we're going to talk a little more about heart conditions and arrhythmias. So join us Mondays. Those are at 10 a.m. Tucson time.
Yes.
And otherwise, we honor you for all joining us here this evening. Pass this on. You'll get it in an email. Pass it on to people. Go to our website. Also, in health conditions, you can drop down to the arrhythmia, and it takes you into the details of all this and has the posting of this video also. So.
Right.
All right. Thank you, Bev.
Thank you, Paul.
And
thank you, everyone.
Yep. Have a wonderful evening.
Have a wonderful evening.